Hello, my name is Mea Ancano. I'm a yoga teacher's trainee from Daily Prana. Today I'm going to discuss with you about the anatomy of the spine. It is very essential to know the physiology and the anatomy of the spine in the context of yoga teaching and practice. We will get to understand and learn what is happening under our skin. As a yoga teacher, it is very important to identify um, difficulties of movement of the students as we guide them on their yoga practice to avoid damage, injury of the spine. What is a spine? A spine is a muscle, bone, or tissue that reach from the base of your skull down to the tip of your tailbone. Alright? As we age, our spine experience wear and tear. Alright? So these are the shape of our spine. The first one is our normal spine. Yes, it is. The second is the scoliosis spine. The third is the kyphosis spine. And fourth is the lordosis spine. This spine is normally the spine of a dancer. So back to the parts of our spine. We have the cervical spine. Alright, cervical spine is located in the upper part of the spine. It has 7 vertebrae and earth spinal nerves. It has foramen or holes or for a full range of motion. It means you can bend, you can flex, you can extend, you can rotate in this area. Alright? We have to avoid damage on this part of our spine because it's very dangerous. Cervical spine is located in the upper part of our spine. It has 7 vertebrae and 8 spinal nerves. Alright? It has foramen or holes so that you can move or you can do the full range of motion. Bending, stretching, rotating. Second part is the thoracic spine, which is located at the midsection of our spine. Normally, this spine is the most stable spine. It has 12 vertebrae and 12 spinal nerves. It is less prone to injury. Third, we have the lumbar spine, or it has the most weight carried part of our spine. It is prone to injury. It is the hinge of our spine. It has 5 vertebrae and 5 spinal nerves. And last, we have the sacral or the pelvic spine. It is the hot spot for all back injuries. It has 5 vertebrae and 5 spinal nerves. Most of the student will go to a yoga for back pain. As a yoga teacher, some are self-diagnosed and always encourage professional healthcare. We will look for postural abnormalities. We should help students correct dysfunctional movement matters, keep students safe, respect, and listen to pain signals. So we don't do or give unsolicited diagnosis as a yoga teacher. We don't give students a label that they have kyphosis, lordosis, and scoliosis. We don't also threat or treat people as a victim. Other conditions of our spines are disc herniation, or the one that they call slip disc. Continuous pain is common to this type of condition. We have the spondylosis. It is a wear and tear condition that affects the facet joints. Spondylolysis is a typical cause by stress or fracture of the bone. Spondylolisthesis is slip vertebrae fracture, and the facet syndrome is often war with spinal extension. We have also the lordosis or the kyphosis, which is exaggerated lumbar curve. And we have the scoliosis, which is genetic, 38%, and 60% is environmental. The common medical solutions for spine injury, some is doing steroid or anti-inflammatory drugs, and some take muscle relaxants, physical therapies, and some are just doing yoga. Okay, almost all back injuries can irritate the nerves. A side effect of the um, um, steroids or NSAIDs are cardiovascular, gastrointestinal bleeding, ulcers, kidney problems, increased blood pressure, and worse, they are break their cartilage and uh, ligament production. Steroid injections or cortisone shots can deteriorate cartilage and but relieves pain, weaken the bones and tissue. Surgery um, is the common cure for other people who experience spine injury. Believe that your body has the capacity to heal. So sometimes injuries can be reversed by strength, flexibility, balance, and nutrition. You can have you can exercise through yoga, because in yoga you will have the right poses, and you can stretch your nerves and your muscle that can regenerate your cells. Yoga is a natural way of regenerating your cells. But doing yoga, you can also integrate this by taking omega-3, um, eating right foods like vegetables and fruits, or pineapple. So there you go. It is very important to take care of our spine, and don't worry, because as a human nature, we are very adaptive. Thank you.